Electrical activity of the heart. There's two parts of that electrical activity. One is the specialized conductive system, and it generates and transmits information to the muscles. And then the muscle is the intercalated disc that are electrical connectors that make the muscle fiber react. The specialized conductive system has 4 parts to it. First, you have the SA node. The SA node, it makes it so that the heart beats between 60 to 80 beats per minute. So it's the pacemaker. It's located in the wall of the right atrium near the opening of the superior vena cava. Then you have the AV node, and the AV node, if it's in charge, it has an average beat of 40 to 60 times a minute. And it's located in the right atrium along the lower part of the interarterial septum. So that would be the center of the heart. The AV bundle is located in the septum of the ventricle. And the Purkinje fibers, they are located around the outside of the ventricles. This picture will help me to show you where things are. So here's the SA node, right? So it's right here. See that little lot right there? That's your SA node. And where's your AV node? Well, it's right here. See the AV node? Then you have your AV bundle. Okay. It's here too. And see how it's right here. This part of the heart. And your Purkinje fibers, they are the ones that are out here. See, they're little tiny fibers. An electrocardiogram. You are going to recognize this more fully as an EKG. Rarely do you hear the full electrocardiogram. It traces the little tiny impulses, electrical impulses, that go through the heart and how they go through the heart. And so it's a visible tracing of the electrical system in your heart. There are 3 ways that we look at when we look at an EKG. And I want to start this with, know that the electricity does not mean that the muscle is working. It means that the muscle was told to work. So the P wave is associated with the depolarization of the atria. The QRS is associated with the depolarization of the ventricles. And a T wave is the repolarization. And you'll go, well, doesn't the atria repolarize? Yes, it does, but the QRS complex hides it. As I mentioned before, when we look at EKGs, we're looking at the electrical part. And the electrical part happens before the contraction. Now, an EKG can detect damage. So what we do is we take an EKG, and it will help us notice if there's damage related to chronic hypertension, ischemia, have they had a previous heart attack. It'll all show up on an EKG. So here's what a P looks like. This is what a QRS looks like. See how nice and big it is. And this is what a T looks like. And these are also disturbed, this one particularly, with if you have a potassium problems. Okay, hypo and hyperpotassium, we said that it changes the contraction of the heart. Well, it is going to change this right here. Here is a picture of walking through the each step of the EKG. So cardiac output, how do we determine cardiac output? Well, it's the volume of the blood pumped by one ventricle per minute. So we would want to know what the heart rate is and how much each stroke, how much volume each stroke put out. What are some things that would affect a heart rate or a stroke volume? Well, how about the autonomic nervous system? Because the autonomic nervous system, remember we said it controls the heart, and that autonomic nervous system, remember, was the sympathetic and parasympathetic. All right, so stress, blood volume disorders, all of these affect cardiac output. Objective number 4, explain the relationship between blood vessel structure and function. Let's talk about arteries, veins, and capillaries. So arteries usually, look at this, usually have oxygen-rich blood. What artery would not have oxygen-rich blood? How about the pulmonary artery? Because it hasn't went to the lungs yet, so it hasn't collected oxygen. How about a vein? Well, usually veins, oxygen is poorly oxygenated blood. Except for one. Which one would it be? What brings the blood back to the heart after it's been oxygenated? The pulmonary vein. Okay. What are capillaries? Capillaries are where the arteries and veins meet and exchange. It makes it so that the nutrients and oxygen can go out into the interstitial space to be taken up by the cells. Now remember from back first chapter probably, or thereabouts, when we talked about semi-permeable and permeable, this is where this is important, right here. Blood vessel structure. The blood vessels have 3 layers. They've got an outer layer, which is the tunica externa. Should be able to remember that because it's the external one. And it's a thin layer of fibrous elastic connective tissue. Then you have a middle layer, which is thicker in the arteries than in the veins, and it's the tunica media. And this is the smooth muscle. So the muscles in the arteries are thicker than the muscle in the vein. Then you have the inner layer. The inner layer is the tunica intima. And it's a single layer of squamous cells that cover the inside of all the vessels and the heart. Here is a picture of each layer, and look at the difference between the muscle on an artery and the muscle on a vein. All right, blood vessels, we've looked at their form, now let's look at their function. Remember that form and function usually work together. So the arteries, they distribute nutrients and gases and so on. and it moves the blood from a higher pressure to a lower pressure. Then you have the capillaries. The capillaries are between the veins and the arteries, and they serve as an exchange for nutrients, waste, and fluids. Then you have the veins, and the vein system is a lower pressure system, and it's bringing the blood back to the heart. Now those veins have valves in it. So what did we say the valves did for the heart? It kept the blood from going backwards. Well, what do you think it's going to do with the veins? It's going to do the very same thing. It prevents the blood from flowing backwards. It pushes the blood towards the heart. This is the arteries that are in your body. The ones that I really am going to stress for you are the right and left carotid. And why would we want to stress those? Well, where do you think you're going to take a pulse if you're doing CPR? It's usually the strongest pulse because it's the closest to the heart. Okay. Then you have a radial pulse and an ulnar pulse. They're right here, right on the wrist. And you'll see that they line up with the vein that they're related to. So they would be just like that. Now, the next pulse that I want you to remember is the pedal pulse. That's the pulse that the vein coming down in the foot. And if you can't get a pulse there on your patient, you will go for the popliteal pulse. And it's right there behind that knee. And I would advise checking your own so that you can help you process where that can be located. The purpose of this slide is some of you work a little bit better with words and some memorize things a little bit better with pictures. And this one has the words for you. This is a picture of the veins and how the veins bring things back to the heart. Now, would I get a pulse in a vein? No. But I might put an IV in that vein. Okay. So you want to look at these. See this arm here? This is where they get all the IVs in. This was intentionally left blank. This is as far as we got in the lecture in the classroom. Objective number 5. Trace the path of blood through the systemic, pulmonary, hepatic, and fetal circulation. Know that we will not be addressing fetal circulation. Blood circulation. It is defined as the flow of the blood through all the vessels that make a circuit or a circular pattern. This diagram helps you to walk through the circle, the closed circuit. Remember we said it was a closed circuit that the blood goes through when it goes through the lungs and through the heart and through the body. I mentioned systemic circulation before. Know that systemic circulation goes throughout the whole system. Okay. And it goes from the arteries to the arterioles, the capillaries, the venules, the vena cava, and the right atrium. Next is the pulmonary circulation. The pulmonary circulation relates to the lungs. And so this is the blood leaving the heart and being reoxygenated and coming back into the heart. So this path, it goes from the right ventricle through the pulmonary arteries, the lungs, the pulmonary veins, and then back to the left atrium. Hepatic portal circulation. When we talk about hepatic things, that is the liver, okay? And the liver filters the blood after the food has went through the abdominal organs. Hepatic circulation. The blood from digestion and the spleen all go into this duct right here, okay? And the blood then goes throughout the liver. And the liver then does the filtering of nutrients that aren't supposed to be in the body. Like if you ingest something that would cause the rest of the body trouble, it'll go through the liver and the liver will help to break it down. Now, once it's through the liver, the blood goes up the inferior vena cava. The other thing that you have to remember about the liver is that it stores glucose. So that's one of its main functions. Objective number 6. Identify and discuss the primary factors involved in the generation and regulation of blood pressure and explain the relationship between these factors. Hemodynamics refers to the set of processes that influence the flow of the blood. So, part of these processes that we're monitoring, we monitor it by doing blood pressure. So blood pressure, what's that? Well, it's the force or push against the blood vessels. And it's highest in arteries, lowest in the veins. And blood pressure is on a gradient, and it helps to produce circulation. So the fluids like to flow from an area of higher pressure to an area of lower pressure. This is a picture to help you to be able to define and understand the process that happens with pressures and what happens with the fluids. So here's our blood pressure when we take blood pressure, and then look at the difference between the arterioles and look at this high pressure here, and it goes right down here to a lower pressure. Fluid will do that all the time. So let's say that I wanted to take a shower and I didn't have running water. I can put a bucket up in the air. The pressure in that bucket will push the water out through a hose to give you a shower. Another thing that affects the blood pressure is blood volume. So if you've got a lot of blood, then you have more pressure on the walls of the vessels. So if you are going to lower that blood pressure, what would you want to do? Well, you would want to take off some of that volume. And so that's why we will use medications that will help you urinate more so that we have lower amount of volume in the system. Another thing that'll cause a change in the volume is a hemorrhage. A hemorrhage is where you've had a large amount of blood loss. So if you have a large amount of blood loss, what's that going to happen to your volume? You're going to have less volume. So if you've got less volume, what's it going to do to your blood pressure? It's going to lower your pressure. Another thing that affects the blood pressure is the strength of the heart contractions. So the strength of those heart contractions affect how much blood comes out of the heart. It affects the pressure within the arteries. And if you have a weaker beat, then you're going to have decreased blood pressure. If you have a stronger beat, then you'll have an increase in blood pressure. Here are some other things that will affect the pressure of the blood in the veins. Heart rate. So if you have an increased heart rate, you should have an increased pressure. And if you have a decrease in the heart rate, you should have decreased pressure. How about the blood viscosity? When we're talking about viscosity, we're talking about how thick it is. Okay, so if you poured water out of a cup and you poured oil out of a cup, which one is going to run the easiest? Well, the water, right? So if you have less than normal viscosity, it's not going to take as much pressure to push that blood around. How about if I have a thicker viscosity? Well, it's going to take more to push that the blood from that heart. So you're going to have a higher blood pressure. And now let's talk about another thing that may affect our blood pressure, and that's the resistance to the blood flow. Well, we've talked about hardening of the arteries before. You know, you'll hear over and over and over about fat intake and it clogging the arteries. Well, if those arteries are not fully open, then you have a resistance, and that resistance will cause that blood pressure to go higher. This is a picture that points out about decreased resistance and increased resistance. Blood pressure fluctuates a little bit, and the normal range is right around 120/80. Know that in the textbook world, 120/80 is a perfect blood pressure. But you will also learn that blood pressure needs to also be considerate of what that patient's full-time blood pressure is. So this is what a normal is. That's our goal for normal. Okay, central venous blood pressure. This is the blood pressure that's within the right atrium. And it is the return of the blood to the heart. And it depends on these 5 mechanisms, what would make it so that affect your venous blood pressure. How strong did the heart beat? Was there an adequate atrial blood pressure? What happened with the valves in the veins? Did the valves in the veins work? The pumping action of the skeletal muscles as they contract. Changing pressure in the chest cavity caused by breathing. That'll make a difference in the venous blood pressure. I mentioned about pulses before. And pulses are the movement of the blood vessels, what we feel. And it changes as the pressure. So we looked at the 9 major pulse points, They're named after the artery that they are up against. So let's take a look at the next slide and talk about those arteries again. Here's our pulse points. And these are the pulse points that you're going to be looking at when you are memorizing where things are.